on my first line of treatment, my oncologist has already said that when this one fails, my next one will be chemo. So when I'm on chemo, am I just on chemo then for as long as it continues to work, or what will it be like?
It all depends on what treatment you've had before, and every breast cancer is different as well in terms of those receptor profiles. Certainly the chemotherapy that we use in the metastatic breast cancer setting is very different to the chemotherapy that patients may have been exposed to in the adjuvant setting. So things like AC paclitaxel, where you're getting combinations of multiple chemotherapy agents. Often in advanced breast cancer, when we're using those treatments, often we might just use one drug by itself, and because there's a big impact on quality of life and there's lots of patient factors that are important in that decision as well. So I certainly have ladies who say, I really don't want to lose my hair at the moment, so we might treat them with a chemotherapy medication that's not associated with hair loss. Or they say, I don't want to be tied to the cancer centre, I want to have a break from needing to come in and getting a medication through my portacath. So we think about an oral chemotherapy medication for them rather than something that's IV. Even sometimes in other cancers, like ovarian cancers, patients may get sort of a 6-month course of treatment and then have a big break where they're just monitored. In the vast majority of people with advanced breast cancer, our treatments go on continuously. Having said that, though, it's also important to work out what's important in your life as well. So we factor in things like treatment breaks. So I have patients that say, I'm desperate to go to Europe, or I want to go on a trip and it's going to be this long, and so we work together to work out, okay, well, how can we make that happen? And if their cancer's stable, then we can certainly work towards that. I guess the good thing with breast cancer treatments and with all the research that's going on at the moment is that we are getting more and more effective treatments come onto the PBS and become available every year. Every oncology meeting we've got new medications. And that's right across from hormone-positive breast cancer, HER2-positive breast cancer, or triple-negative breast cancer. Sometimes what your oncologist might say, I think that might be your next treatment. When you get to that point where you need your next line of treatment, we might have something newer and better that's better tolerated for you at that stage. So it does change constantly as well.
If I did lose my hair, which I'm cool with, if that happened and you're on that treatment continuously, then, like when I was on it the first time, I lost it, but then while I was on it, it started to grow back. So is that true again? Would it start to grow back while you're continuously on it, or would it just stay not there for the entire time?
Again, yeah, depends what treatment you're on. So often a lot of ladies have had AC paclitaxel, and with doxorubicin, so that A in AC, that causes 100% hair loss after the first dose if you're not having any sort of scalp cooling or anything. But during the paclitaxel, or in the advanced setting, we sort of use a medication called Abraxane, which is basically the brother of paclitaxel, or the same treatment. Sometimes people can get some hair growth coming back, so some sort of very fine sort of fluffy growth coming back during that treatment as well. Usually once that treatment stops, and if you're onto a new medication that's not affecting the hair follicles will recover and your hair will come back.